Hi, this is Tiana Collins, and this is video 1 for Module 2, Pathophysiology. This is Lindsay, who's going to be helping me with my definitions.
Disease.
Disease is an abnormality of a structure or function that produces specific signs or symptoms to a specific location. It can be either in a human, plant, or animal. It can be physical or psychological, and it is not related to a physical injury. An example of a disease in this video will speak a lot about leptospirosis, which is a bacterial disease caused by a bacterial spirochete that enters into the body and then causes signs and symptoms in the liver and kidneys, as well as it could also cause meningitis and even death.
Diagnosis.
Diagnosis is the determination of the nature of the disease and cause of the disease. In order to get a proper diagnosis, you take a thorough history as well as do a thorough physical exam, and then you may even need to run diagnostic tests such as blood work and or x-rays. Once you have all of your information, looking at your history, your physical exam, your signs, your symptoms, and the results of your diagnostic tests, you can then make a diagnosis, the nature of the disease. An example of a diagnosis, again going back to leptospirosis, in order for us to diagnose leptospirosis, we look at the signs and symptoms, high fever, vomiting, kidney failure, liver failure, jaundice, red eyes, could also have meningitis. We take that, couple it with a complete history, good physical exam, and a positive lepto-PCR blood work test. And if we have all of those that come together, we can make a complete diagnosis of leptospirosis.
Etiology.
Etiology is the root cause of the disease and all the factors that go along with it. Root cause being the primary keywords there. An example of etiology, again using leptospirosis, is the bacterial spirochete that causes the lepto disease. That will then enter into the body. It can enter through broken skin, mucous membranes, or respiratory droplets that are inhaled.
Disease classification.
Disease classification was created by the World Health Organization, the WHO. It covers over 112,000 codes and has 31 countries in it. Almost every disease or illness that we suffer from has its own unique code. Illnesses such as morbidity and diseases for mortality are in the classification, and it is a statistical mapping of the prevalence of these diseases as well worldwide. There are 8 classifications in the book, the first one being topographical, that goes by body region. The next one is anatomical, which is organ or tissue. There is physiological, which is functions of the disease. There's pathological, which is the nature of the disease. There's etiological. There is juristic, which is the advent of death or speed of death. There is epidemiological and statistical. The name of the book is the International Classification of Diseases and Related Health Problems. It is called the ICD. It is a very important statistical mapping device that covers the prevalence of diseases, and almost every health facility in the world uses it to make financial decisions, help with diagnosis, help with treatment, and prognosis, as well as coding for the insurance companies. An example of the use of the book was when the prevalence of lung cancer increased. They used that book to link it to cigarette smoking.
Pathogenesis.
Pathogenesis is the mechanism of disease, being the root words here, and that is how the disease progresses in your body and how the course that it takes once in your body. An example of pathogenesis, going back again to leptospirosis, Once the spirochete is in your body, it then gets into the bloodstream, where it travels usually to the liver or kidneys, where it then will start to shed into the urine. Once it has taken up residence in your body then mounts an immune response. It is the immune response to the bacterial spirochete that causes the signs and symptoms that you see, causing the mechanism, which is the mechanism of disease, those signs of symptoms. Some of those signs of symptoms can be vomiting, red eyes, jaundiced skin, liver failure, kidney failure, heart failure, and death. And that is the mechanism of disease.
Diagnostic media.
Diagnostic media is a media that is usually inoculated with nutrients, that is used primarily in microbiology to grow pathogenic bacteria and or yeast. And then once the pathogen grows on the media, it can be separated out and examined under the microscope to identify it. Once it is identified, you can then use that identification to create a treatment plan to treat your patient. An example of diagnostic media would be the mannitol salt agar plate that is used to grow the staphylococcus bacteria that causes MRSA.
Symptoms.
Symptoms are subjective traits of the disease, evidence of the disease that only your patient can express. An example of a symptom would be a headache or a stomach ache. Syndrome is a complex that takes into effect all of your signs and symptoms. An example of a syndrome would be Down syndrome, where your signs and symptoms are abnormalities of the eyes, trisomy 21, short stature, heart problems, hearing, and vision and thyroid problems. When you take all of your signs and symptoms together, you then have a complex, which is then a syndrome. Sign is an objective evidence of disease that an observer is able to measure or see. An example of a sign would be jaundiced skin or vomiting. Prognosis is the likely path that a disease will take, especially if it goes untreated. An example of prognosis would be somebody who is diagnosed with diabetes who does not treat their diabetes. It will then progress and cause additional signs and symptoms, and probably death sooner than it would have been if they had been treated.
Okay, last one, complications.
Complication is something that is unexpected, that happens either during a treatment, procedure, or an illness. An example of a complication is your patient arrests and dies on the operating table in what would have been a normal surgery. Thank you, and I have a list of all my citations that I used in order to do this video.